Many people will suffer back, neck, hip, and knee pain at some point in their lives. But when we get older, the risk becomes higher. We spoke with Dr. David Duffner at Desert Regional Medical Center in Palm Springs. We asked him about orthopedics after the age of 55.
Mostly it's the aging process, plus if you've had injuries when you were young, playing sports or whatever, it kind of catches up with you. The repair process kind of slows down as you get older. So as the tissue, particularly cartilage and that sort of thing, as it degenerates, then the body is less able to repair it. The main complaint that we see in orthopedics, of course, is pain and how that affects your function. So that's the two things that we deal with, is pain and lack of function. It's mainly the big joints that get a lot of wear and tear as life goes on. And then there's just the basic aging process that affects primarily the spine and to some extent some of the other joints as well.
Dr. Duffner talked about problems in the knee and knee replacement surgery.
This is a model of a knee replacement, and these are the actual implants that we use when we do this operation for people. Now normally the end of the bone is covered with articular cartilage. The term is called hyaline cartilage. And that's a smooth, kind of rubbery tissue. And it's on the end of the femur and on the tibia. And then there's also the kneecap right here. So there's actually 3 bones in the knee. So with normal cartilage, there's very little friction and everything moves very smoothly. And as we age, that cartilage breaks down. The collagen degenerates to some extent. The material in between the cells, the matrix breaks down, and so people develop wear and tear where the cartilage is literally worn away, and then you have just bare bone against bare bone. That's the end stage arthritis, and that's when people get to the point that they need a joint replacement.
Dr. Duffner also talked about the hip and hip replacement.
Well, this is a model of a left hip. This is the left half of the pelvis, and this is the socket, which is called the acetabulum. This is the top of the thigh bone. This is the femoral neck and head. So what happens is, again, the cartilage in the articulation between the normal femoral head and the normal acetabular socket, that cartilage, that joint surface in there just literally wears out. The material just gets worn away off the end of the bone, so you get bone-on-bone arthritis, and this is a model of a hip replacement.
We asked Dr. Duffner if any of these problems can be prevented as we age.
It's basically just good health principles. It's basically what you should do for yourself for all conditions, and that is stop smoking, exercise, don't get too heavy, try to maintain ideal body weight, good nutrition, protein. Your body uses protein as a building block. Vitamins, I believe that vitamins are essential because you don't necessarily get everything you need in even a good balanced diet, and adequate exercise. And stretching. Stretching is very important, and even people that exercise, most people don't stretch enough. As we get older, we get tighter. Everything gets a little stiffer. Your joints get tighter, and then when you do have to move, it creates more stress on those joints because they don't move as easily. So stretching is very important. It's important to have some form of weight-bearing exercise because bones are only as strong as they need to be. So particularly as a prevention of osteoporosis, it's important to have some type of weight-bearing exercise. But then you also need some cardio exercise to get your heart rate up and maintain good cardiovascular fitness. So it's a combination of all of that. There's not just one thing you can do. It's really a combination of all of those things that I would just call a healthy lifestyle.